AI is here today. There are the pros and there are the cons. The pros are more than the cons. AI is not here to replace human beings. AI is here to augment the surgeon. For example, today we can see within a patient the amount of oxygen that is passing into the tissues. So if you cut something and you have taken away the blood supply or the oxygen, then it is not going to work, even if you do a beautiful job. AI now allows us the opportunity to see things which my eyes could not see before. We can, for example, today take an organ, say a prostate gland, we can take the scan from it, an MRI scan, we can then pass that through an AI called Mona AI label. We can get a 3D print of the patient's prostate, and we can individualize, personalize the operation to that patient, not do the same job for every patient. But this has to be done in a responsible fashion. There are concerns about data privacy, about patients not having the trust in AI, so it has to be done in a responsible fashion. Telesurgery is one of the best examples internationally of responsible AI that we have delivered between the London Clinic and Gibraltar Health Authority.
So you mentioned the concerns that people have over AI. I think the concern that many people have is less human oversight. So what safeguards are in place to ensure that there is human input and insight and that things are checked?
So there has to be a human in the loop. People are talking about autonomy all the time. Recently, in the Nature journal, we have had humanoid robots being able to do gallbladder surgery. We have had a fully automated robot from Johns Hopkins in the United States able to take out a gallbladder in a pig. So these are all in a lab. I don't think these things are going to take away the human judgment, because that is vital. Second, we need a lot of data to train these algorithms. That diversity of data is fundamental. If you choose a population and try to use their data into a different population, it's not going to work. The AI is going to make mistakes. And finally, that data has to be sovereign. You cannot just pass it across borders. You cannot use the wrong data, and you cannot make the public feel that their data is being used where it shouldn't be used. So winning the trust of patients and the public is vital. If we don't do that, then AI in surgery, as in everything else in life, is inevitably going to fail. So it is up to us as clinicians to build trust and responsibility in AI systems.
And finally, what message would you like people to take away from this talk today here at the St. Bernard's Hospital, the healthcare professionals to whom you'll be speaking?
I think the future of AI in surgery is very, very exciting. Look, there is ambient AI already here. Heidi, for example, can generate letters for us, can accurately record the patient data, that conversation, use natural language processing, and provide that input much faster than a human being can. So that is already here. The message I want to give to our patients and the public here is that this is a very exciting future, as long as we do it responsibly. Telesurgery is part of that responsible AI ecosystem. There is already such an ecosystem which is funded by UK Research and Innovation, where we are trying to put AI champions in every hospital. Gibraltar can lead on telesurgery, not just for Gibraltar, but for the whole of UK, wider still into Europe, and learn the lessons from Gibraltar into the rest of the world. I think this is going to be very positive. One of the downsides is the future of work. That is going to change, inevitably. Those who want to do well in that future will have to embrace AI. AI is not going to replace them. It is just going to change the future of work. So I am incredibly positive about the role that AI will play in the future of surgery.